My name is Dr. Brett Richens with Aspen Heights Dental, and I wanted to talk a little bit today about periodontal disease. Maybe you've been told you have periodontal disease and you don't know exactly what that means. You have gums that tend to be bleeding, sore, and you're worried about that. And what can happen with our gums over time if you've been putting off seeing the dentist, getting your regular cleanings, is we can get a buildup of what's called tartar or calculus under your gums. And that tartar or calculus can become a chronic irritant for those gums, causing redness, swelling, inflammation, and eventually pain. As that swelling and inflammation occurs, often what will happen is the gums and the bone will start to shrink down. A lot of people who have periodontal disease will say if they feel like their tooth's getting longer or their gums are starting to recede significantly. We can have some gum recession without having periodontal disease, but if you're getting significant recession, you're starting to see a lot of the root of your tooth. Often that means the bone is starting to die back away from that inflammation and that tartar and calculus, and the gums are following that. And what we do for patients when they have periodontal disease is first we do a screening to figure out how severe that is, how far along in the process we are, and then we can come up with a personalized plan and treatment for you. What typically is recommended is what's called a scaling and root planing. And that is when a hygienist goes in and spends more time with you. Typically you'll need to be numb to get this procedure done because of the periodontal disease. Your gums are sore, they're tender, there's often some pain involved whenever you get a normal cleaning, so some anesthetic can help with comfort. And then they spend time going in cleaning out all of that debris, the bacteria that's living under your gums and that tartar and calculus, and get the gums and bone back to optimal health. And so if you have periodontal disease, it's important to understand the mouth isn't just a standalone part of your body that you have swelling and infection in your mouth and it doesn't affect the rest of your body. In fact, it's quite the contrary. Your mouth is a good indicator of overall health and it affects your overall health. So if you have swelling, infection, bleeding in your gums, that can affect things like heart disease. It can be a concurrent problem with people who have diabetes. And so it's important that we treat this and take care of it for you so that you don't have other health issues that can be related to periodontal disease.